Good evening, Mr. Cuenca. Good evening, class. My name is Tatiana. Last name is Lei. I am currently employed at St. Joseph Hospital as a circulating nurse in the main OR. And I find that communication is utmost important in healthcare because it acts as a safety tool. I feel that when you communicate, it serves as a continuity of care for the patient, because what happened is it's a domino effect. If step one didn't happen, then step two will fall, and step three will further fall behind. For example, as a circulating nurse, at the beginning of the case, we do a briefing, meaning I would talk to the surgeon as far as communicating with him what he will need for the procedure, such as equipment, medications, patient positioning. Also, it will include the patient's medical conditions, also the exact procedure. After that, myself will communicate with all the ancillary staff, meaning if I want to need x-ray, whether it's a portable x-ray, it's a C-arm, if I'm going to need certain rep standing by for instrumentation or implants, equipment, and I also have to test it out, make sure the equipment it's in functioning condition, because I can't have the patient on the table and find out last minute that we don't have the equipment or the implants, or the equipment is not functioning. This helps the whole team to conduct the procedure in a safe manner. And after the procedure, we do something called a debriefing, meaning are we anticipating this patient to be in ICU, go straight to recovery room, or will be discharged home, or this patient needs to be admitted for one night stay for observation. And with that in mind, we will have to communicate with the department involved, which is a recovery room, an ICU, a step-down ICU, medical floor, or surgical floor. So depends on the patient's situation warrants. The surgeon and the team will do a debriefing and will arrive at the decision almost towards the end of the procedure, so that way I could communicate. So when I do transfer my patient to whether an ICU or just recovery room, I will paint a whole picture of what happened in the operating room, such as the exact procedure, medications that were given, the positioning of the patient in case the patient later on complains of soreness and pain of areas that we didn't operate on because of the positioning. Also, I will communicate any urine output, IV fluids that were used, what kind, and also the estimated blood loss. And if we use a tourniquet at all, I also communicate the millimercury that was sat at and the amount of time for the tourniquet. This way, the nurse in the department who's assuming the care of this patient will have an idea of what was done, and so that way she can anticipate the equipment or any changes in vital signs because of the medications that were given. It's all about safety. It's all about continuity of care, and so on and so forth. With her, when later she has to transfer the patient to the next department, the same communication follows. And along with the communication, of course, we go through three types of patient identifier. Means the patient, the label or addressograph, and also the patient has to verbalize with myself, or there'll be two nurses if the patient was anesthetized and unable to identify him or herself. So this way we'll eliminate the potential mistakes. Communication, to me, in any type of setting, whether we're in the airline industry, in the business, in the outside world other than medicine, or even in a family situation, when you communicate, the other person have a better understanding and able to anticipate what is to be expected, what is to be happening, and what will be the result or possible result. So this way we can, I suppose, reduce the chance of errors, delays, and frustrations, and sometimes it could lead to potential harm and or could be costly in the real world. So in short, I feel that when I communicate with the doctor, the nurses in pre-op, and get a nice report, short and sweet, I have an idea of what to anticipate, and I can communicate this to the anesthesiologist, to anesthesia techs, to scrub techs, to my team leader, to even to as far as EVS. Because if should I have a patient who's in isolation, the whole team needs to take precautions from A through Z, meaning from surgeons, anesthesia, from the room to the equipment to mopping the floor. Everybody have to work together as a team. So to me, team communication saves lives. And I feel that if we lack potential harm, it will be a lot greater than just taking a few extra minutes to do a little team briefing. And briefing doesn't have to take place immediately right before you give the care to the patient, but it could be while you're setting up your room, while you have a little downtime. You can always call. You don't have to. There's so many ways to communicate. You can communicate via email, via text, via web page, via ESCOM phone. There's many ways to communicate. And I believe that if you really want to reach out and communicate, when you have a will, you have a way. And it's just a good way of save patient care. And I just want to thank you for your time. And I hope that my input will make a difference in how we all practice to practice safely for our patients and our community. Thank you so much and have a good day.